Good day everyone, I am Ivan Carla Candola from BSN1 Y3-5. Today I will be performing a return demonstration on how to give a complete bed bath and proper positioning to our patient. To start off, we must observe the standard protocols. First, we need to verify the doctor's orders regarding any restrictions and or limitations. Next, we should perform hand washing and observe other appropriate infection control procedures like cleaning and disinfecting all surfaces and equipments needed to ensure a safe environment for us and to our patient as well. We also need to apply for the principles of body mechanics as part of the standard protocol. This involves having a good posture where you keep your head upright and your shoulders back. The next thing that we should do is to prepare our patient. Good morning, sir. I'm Ivan Carla Candola, your student nurse for today. For our verification, can I take a look at your patient tag, please? Can you state your full name, sir?
Jero Candola,
How about your birthday, sir?
October 21, 2010.
Alright, sir. Thank you. So, for today po, I'll be giving you a bed bath. This is important po to keep your skin healthy and it also removes or cleanses your body from any dirt, debris, and perspiration. Make sure to maintain the comfort and safety of the patient. Always keep the privacy of the patient throughout the procedure. Assess tolerance for back, any shortness of breath, and condition of the patient's skin. So, I'll just assess your skin po. Do you feel fine po, sir? Alright. Would you like to void at this point po before we start the procedure?
No.
Alright po, sir. After preparing the patient, gather all the materials needed. For this procedure, we will be needing basin with warm water between 43 degrees Celsius and 46 degrees Celsius, soap, linens including a bath blanket, 2 bath towels, a washcloth, clean gown or patient pajamas or clothes, and additional bed linens or towels if required. We also need clean gloves, personal hygiene articles like lotion or deodorant, also table for bathing equipment I have here at my side, and lastly, we need laundry bag or portable linen hamper. To start the procedure, I have raised the bed into a comfortable working height and lowered the side rails on my side and help the patient to assume a comfortable supine position, maintaining body alignment. Next, I will be donning my gloves. this time, sir, I will be removing your blanket and top sheet, and I'll be putting a bath blanket over your top.
Place a bath blanket over the patient. Have the patient hold the top of the bath blanket. Remove the top sheet from beneath the bath blanket without exposing the patient. Place soiled linen in the dirty linen bag.
Alright, sir, this time I'll be removing your clothes bag. After removing the patient's clothes, the next thing that we should do if we are in a hospital setting is to lower the bed and raise the side rails for that. Next, I have filled here a wash basin 2/3 full of warm water, and this time, let me check the temperature and ask the patient if it is tolerable for him. Sir, would you please check the temperature if it is tolerable for you? Is it too hot or too cold? Sir? After checking the temperature, the next thing that I will do is to put the towel on the patient's chest and head.
Place a bath towel under the patient's head. Place a second bath towel over the patient's chest.
So, sir, I'll be starting to wash your face.
Immerse the washcloth and wring it out thoroughly. Start forming a mitt with the washcloth.
Alright, sir, I'll start with your eye spot.
Using a clean area of the cloth for each eye, bath from the inner to the outer canthus. Dry gently and thoroughly around the eyes.
Would you like to use some soap for your face spot? No. Alright.
Wash, rinse, and dry the forehead, cheeks, nose, neck, and ears.
Let's start washing your forehead spot.
Wash the upper extremities and trunk. Place the bath towel lengthwise under the arm. Immerse the washcloth and wring it out thoroughly. Start forming a mitt with the washcloth.
This time po, sir, I'll be using a soap to cleanse your body well.
Use long, firm strokes and move in a distal to proximal direction. Wash the hands and nail. Rinse and dry the arm and hand.
Right, next po, can you raise your hand po?
Wring out the washcloth thoroughly. Start forming a mitt again with the washcloth. Apply minimal amount of soap. Wash, rinse, and dry the axilla thoroughly.
This time po, sir, I'll be washing your other arm po.
Repeat the steps with the patient's other arm, axilla, hand, and nails.
This time po, sir, I'll be washing your chest po and your abdomen.
Cover the patient's chest with a bath towel. Fold the bath blanket down to the umbilicus.
By the way, sir, would you like to apply some deodorant? Okay.
Immerse the washcloth and wring it out thoroughly. Form a mitt with the washcloth. Make sure to apply enough soap. Bathe the chest using long, firm strokes. Bathe, rinse, and dry the abdomen.
This time po, sir, I'll be washing your back wall. Please turn on.
Help the patient assume a prone, side-lying position. Place a clean towel lengthwise along the patient's side or back. Slide the bath blanket over the shoulders during bathing. Immerse the washcloth and wring it out thoroughly. Form a mitt with the washcloth. Make sure to apply enough soap. Wash, rinse, and dry the back using long, firm strokes.
This time po, sir, I would apply some lotion at your back.
Put the clean gown or pajama top on the patient by dressing the affected side first.
Sir, let me just comb your hair. Alright, sir, now I will be making your bed po.
This pose use gloves. This time, make sure to apply clean gloves. Start making the patient's bed.
for the last part of our bed bath, we need to check for the function and position of external devices such as indwelling catheters, nasogastric tubes, intravenous tubes, and braces. Assuming that we have already done that part, the next thing that we should do is to do the proper positioning of our patient. Before positioning a patient in bed, we need to verify the healthcare provider's orders. After verifying the healthcare provider's orders, the next thing that we should do is to provide some privacy for our patient. After doing that, we should perform hand hygiene before starting the procedure. Next, we need to introduce ourselves and verify our patient's identity using two identifiers. Good morning, sir. I'm Ivan Carla Ilacandola, your student nurse. For verification po, can I take a look at your patient tag? Can you state your full name, sir?
Jairo Bilangandola,
How about your birthday, sir?
October 21, 2010.
Alright, sir. Thank you. Make sure to position the patient in any of the following positions using correct body alignment. Protect pressure areas and begin with the patient lying supine. Remember to place the bed in a good working height. For the first one, let us position the patient in the supported Fowler's position.
Raise the bed to a working height and elevate the head of the bed to 45 degrees.
Assuming that I have already elevated the head of the bed 45 degrees, the next thing that we should do is to rest the patient's head against a pillow. So let me just reposition your pillow, sir, for a comfortable position. How about that, sir? Do you feel comfortable enough?
Yes.
Alright, let me just roll this down.
Use pillows to support the arms and hands of the patient if he or she does not have voluntary control or use of the hands and arms.
Would you like me to put a small pillow behind your back, sir?
No.
Alright.
Place a pillow or roll under the patient's thighs. Support the patient's calves and ankles with a pillow or roll. Place pillows or rolls at the feet to keep it aligned and maintain dorsiflexion.
Alright, sir, let me just put this back. Next, position the patient in the supported supine position. Good morning, sir. Let me just make your position comfortable. So let me just lower the bed. Would you like to put a lumbar pillow behind your back, sir?
No.
Alright.
Place a pillow behind the patient's upper shoulders, neck, or head if needed.
So let me just put a pillow.
Place pillows under the patient's pronated forearms, keeping the upper arms parallel to the patient's body. Place trochanter rolls or sandbags parallel to the lateral surface of the patient's thighs. Protect the patient's feet with a small trochanter roll. Place the fingers and thumb of each of the patient's hands around the rolled cloth.
This time, let us position the patient in the prone position using two nurses if available. Let me just remove your pillow, sir. Just bring this down. Alright, this time, sir, I'll be moving you on this side.
Move the upper trunk first. Then, move the patient's lower trunk. Adjust the patient's legs and feet to maintain good body alignment. The patient's arm on the side to be turned should be held alongside the body. Place a towel or pillow beneath the patient's abdomen.
The count of 3, I'll be updating you. 1, 2, 3.
Keep the elbow straight and the hand tucked under the hip. Support the patient's arms in the flexed position at the level of the shoulders. Turn the patient's head to one side and support it with a small pillow. Support the patient's arm with a small pillow. To elevate the toes, gently wedge a pillow below the patient's lower legs.
And let me cover your too. Next, position the patient in a 30-degree lateral or side-lying position. Sir, can you just
Position the patient on the side of the bed facing the opposite direction toward which he is going to be turned. Move the patient's upper trunk first. Then move the lower trunk after. Flex the patient's knee that will not be next to the mattress. Go to the other side of the bed. Place one of your hands on the patient's hip and the other on his shoulder. Roll the patient onto his side toward you. Place a pillow under the patient's head and neck. Place your hands under the dependent shoulder and bring the shoulder blade forward. Place a small tuck-back pillow behind the patient's back. Support the upper arm with a pillow that is level with the shoulder. Place a pillow under the patient's semi-flexed upper leg at the level of the hip from groin to foot. Place sandbags or roll parallel to the plantar surface of the dependent foot.
Lastly, let us position the patient in the Sims or semi-prone position.
The patient's arm should be tucked alongside the body. Flex the knee of the leg that will not be next to the mattress and turn the patient onto his side. Place a small pillow under the patient's head. Place a pillow under the flexed upper arm. Place the arm out of the patient's side. Place a pillow under the patient's flexed upper legs, supporting the leg so that it is level with the hip. Place sandbags or small trochanter rolls parallel to the plantar surface of the patient's foot.
After doing the proper positioning on our patient, place toiletries and personal items within reach. Also, place the call light within easy reach and make sure that the patient knows how to use it to summon assistance. Don't forget to neatly arrange personal possessions of the patient. Assuming that we are in a hospital setting, the next thing to do to ensure the patient's safety is to place the bed in the locked, low position with at least 2 but no more than 3 side rails raised. Assuming that we have done this part already, dispose of used supplies and equipment. Leave the patient's room tidy. Remove and dispose of gloves if used, and then perform hand hygiene.
Document and record the patient's response and expected or unexpected outcomes. Don't forget to include how much the patient participated and how well the patient tolerated the bath.